Happy Thursday to everyone. Um, Hopefully you can hear me. Let me just make sure before I get started that you can hear. Thursday to everyone. Hope- okay, it looks like you can hear me. So today I wanted to come in and talk about something that I've been seeing on social media concerning healthcare costs. Now, normally I would have done this as something that I just actually recorded and put out. But here lately, I haven't had the patience to basically record a video and then upload it to YouTube. A lot of the stuff has changed, and during the change, I wasn't paying attention, so I don't even know how to do it or get monetized for my videos. I got to sit down and figure that out. But I wanted to talk about healthcare costs and who pays it and how it's paid. And let me explain why. Because I was on like social media and I kept seeing this thing where people are saying that when a hospital or a facility gets a COVID-19 patient, that they're being paid extra for it, and there's some type of, I guess, scandal behind payment. And I just wanted to talk about what I know about, pricing when it comes to health insurance companies. And let me just give you a little background on me and why I know a little bit about it. So, as I've told a lot of y'all, I work in health insurance and I've worked for health insurance companies for the last 11 years. I started off with Blue Cross, I've worked for Medicaid, Medicare, and just private insurers. I've done all types of jobs within that background, from being looking at claims and talking to providers, members, doing prior authorizations, referrals, all kinds of stuff. So I know a little bit about it. So when I was on social media, a lot of people were saying that, as I said, that when these facilities or these hospitals are getting these COVID-19 patients, they're getting extra money. So my question to the people that I kept seeing post that was, who are they getting this extra money from? And what government entity is paying them? And this is why I asked this question, because normally when you, I'm just going to give an example. Say that you are scheduled for some type of procedure. Just say you need a hip surgery. So the first thing your doctor is going to do is they're going to call your health insurance company. They're going to get your, what your benefits are. They're going to ask if, if there's any pre-authorization needed before they can perform that procedure. I'm just going to go through the whole thing and how it plays out. So at the insurance company, we're going to tell them your benefits. We're going to get that authorization set up. Basically, we're going to wait for them to submit your medical records, providing proof that you actually need this surgery, medical proof. Once all of that is received and we are able to get that procedure approved, then you're all set for your surgery. So you go in, you have your surgery, and after you have your surgery, your doctor's office, your doctor submits his claim. Now, let me just tell you how it all breaks down. So, the person that gave you your anesthesia, they're going to submit a claim. If you needed any radiological things done, the radiologist is going to submit the claim. The hospital is going to submit a claim. The facility is going to submit a claim. All these different entities that you came into contact with when you had that surgery, they're going to submit a claim. Now, as far as what they're going to get paid, this is how it works with health insurance companies, because I think a lot of people are really confused about who sets pricing and all of that. So basically, it's the insurance company that sets the price. So what they do is just say you're having that hip surgery and the doctor charges $50,000. And I'm just using a number because we know it could be more than that. Just say your doctor's office charges $50,000 for that surgery, but the insurance company only pays $35,000 for that surgery. So what happens is that facility enters into a contract with that health insurer, say like Blue Cross, Anthem, United Healthcare, what is it, Aetna. Just say they enter into a contract with them. That contract says, as the provider, we agree to accept that $35,000, and the balance, you remember, they actually charge $50,000 for the giving you that hip surgery. The balance they write off. And also written into their contract is the fact that they cannot balance bill the patient. So meaning that if they only got 35,000 and there's still $15,000 to be paid, they actually write it off. And that's part of the contract. And this thing where people believe that doctors are just charging what they want all willy-nilly, and they get paid what they want, that's just not true, because they don't set the pricing. It's the insurance company that does. Have you ever been needing to get something done, and your doctor's office keeps telling you that they're waiting on, your insurance company to get everything together? Well, they are ruled by what the insurance company is going to do. I cannot tell y'all how many times I've sat on the phone with a facility or a doctor's office, and they have billed their claim. They billed everything that they did to you that day on their claim. And we tell them, okay, we'll pay for this. We're not paying for that. We'll pay for this, and we'll pay, but we're not paying for that. And I'm arguing back and forth with this doctor or this facility because they feel that they should be paid for everything that they bill, and it just doesn't work that way. Let me give you an example. So another example would be like this. Say you broke your arm and you went to the doctor, the emergency room, to get it repaired, get it set. So this is how an insurance company looks at that ER visit. So because you went to the ER, we're going to pay that facility for the use of that ER room. So they're going to get paid. But here's how it breaks down when we're paying for your actual procedure. So you know how if you get your arm set, you need a cast, you need medicine, you need this, that, and the other. The way the insurance company looks at it is this way. We're only going to pay for the setting of your arm, because to set your arm, you're going to need the cast, you're going to need anesthesia, you're going to need this, that, and the other. But we're only going to pay on the highest. It's like a hierarchy. We're only going to pay on what you actually went there for. They couldn't set your arm without a cast, so we're not going to pay for the cast. They couldn't set your arm without anesthesia, so we're not going to pay for the anesthesia. All of that is bundled into what we're paying for that broken arm. So all of these different wild ideas that I'm seeing that people are posting about healthcare costs during COVID-19 is just not true. Here's another thing that I saw on Facebook. There's a lot of going back and forth that because, like, just say a nursing home is accepting COVID-19 patients, they ask to be a place where COVID-19 patients are being treated, that they get extra money. So I got to thinking about that. I said, okay, who is this entity that people believe are giving them extra money. So I kept asking that question, and people were saying, quote unquote, the federal government. So then I asked, well, what office in the federal government are you speaking of, like Medicare and Medicaid? And let me tell you guys the reason why I kept trying to get them to say which office it was, because any of you who have Medicare or Medicaid, you know that they have set pricing, and their pricing is actually lower than what, say, Aetna, Blue Cross, United Healthcare pricing is. And also, Medicare and Medicaid are always the payer of last resort. And this is what I mean by that. Say you are a person that has United Healthcare, but you also, because of your illness, you're eligible for Medicaid or Medicare. This is how the insurance companies pay. So just say United Healthcare is your primary insurance, and then you have Medicare and you have Medicaid. So that means you have three insurances. So basically, the way that the claim is going to go is, if United Healthcare is your primary insurance, their United Healthcare sets the pricing of what's going to be paid for your procedure. So let's use that hip replacement. So just say United Healthcare pays $35,000 on a $50,000 hip replacement. So United Healthcare is going to pay what they would normally pay for that procedure. But that's not where it ends. So remember, I said, say this person has United Healthcare, they have Medicare, and they have Medicaid. So then, after United Healthcare pays on the claim, then your provider, the hospital or the doctor, is going to submit the claim to Medicare. Now, what Medicare is going to say is, okay, on that same hip replacement, we would have only paid $20,000. You remember, United Healthcare paid $35,000. So Medicare is going to say, because United Healthcare paid more than what we would have paid on it had it been submitted to us first, then we're not paying anything, because United Healthcare paid all that was, more than what we would have paid. But remember, you also have a third insurance, which is Medicaid. So this is tertiary. We call it like your primary, your secondary, and then tertiary is your third insurance. So then that provider will then submit, because they have to submit it to all of your insurances. So then that provider will submit it to your Medicaid. Now, Medicaid, of course, is going to say, okay, United Healthcare paid $35,000. We would have only paid, we go by Medicare guidelines. We would have only paid $20,000. So we're not paying anything on it. But they have to submit it to all of the insurances. So what happens is, that doctor's office, because they are contracted with United Healthcare and they agree to only accept that contracted rate, which is 35,000, they write off the rest. They could not bill it to the patient. They agree to write it off because it's part of their contract. Now, you might be asking yourself, why would they do that? If they are billing, $50,000 for a procedure, why would they agree to only accept 35,000 from the insurance company? The reason why is because they want to be part of, say, United Healthcare's their provider pool. They want to be in that provider pool because they know that this is better than someone who comes in without insurance and they're taking a chance on not getting paid anything. So they say, well, okay, well, at least with United Healthcare, if we're part of their network, we're going to get paid something. It may not be what we agree, what we would normally bill someone without insurance, but we're going to get paid something. This notion that, when it comes to healthcare, that, you know, doctors and facilities are just billing what they want. That is not true, y'all. Again, like I said, I've been on the phone with doctors' offices where they even try to kind of, do creative billing, or they add on stuff to try to slip it past us at the insurance company, and not meaning that they're like, you went in for hip surgery, but they also said they fixed your foot too. Not stuff like that where they're out and out lying, but they'll try to include services that they know that they're not going to get paid for. Um, and we are telling them, that that's part of the actual overall services, so we're not going to pay for that. Also, have you ever had a major surgery and then you have to go back in a few weeks for your follow-up appointment? Did you know that a lot of times that the doctor's office is not getting paid for that? What we call it at the insurance company is it's like a global period. You know how your doctor say, after your surgery, come back in 6 weeks. Well, we look at it this way at the insurance company: all the appointments that you have directly following a surgery and that are related to that surgery should be considered part of that whole getting you back well. So we're not going to pay on it because you're still within that global period. Now, that doesn't mean like 6 months down the line, if that doctor had to treat you for something, that they're not going to get paid for. It means like this: like, different insurance companies have like a different global period for directly following your surgery. So say they say within 21 days, if you have to go back to your doctor concerning anything related to that surgery, we're including it in that global payment. But here's the thing: the doctor's office still submits the claim because they want to show that they are doing follow-up treatment, related to that surgery. Another thing that I want to talk about is the ACA, and which is also known as Obamacare. Y'all, I worked in healthcare prior to Obamacare, and I worked in healthcare directly after it was passed. And what I remember from before it passed is all these protests, the Tea Party saying, putting out all this propaganda about the ACA and all of that. And being a person working at a health insurance company after it passed, and all of the stuff that was included now in healthcare, especially like, um, in regards to women's health, like, pap tests and different things that we have to get because we are women. Prior to Obamacare, you may have had to pay like for a certain portion of it, or you had a deductible, or you had this. But after Obamacare, certain things that you need to get according to your age, um were set up where you don't pay anything other than maybe your office visit, depending on what your insurance carrier charges for office visit, but you weren't paying for the treatment that you were receiving. Like, say you were a woman and you needed your annual pap test. Prior to Obamacare, we may have had to pay something, but after Obamacare, we didn't. Same thing with certain immunizations, certain dental procedures, routine. In other words, any routine procedures that you needed, once Obamacare came along, it was rolled into it. Now, let me tell you, when people realize what how Obamacare changed their their health care. Remember when the Trump administration first came in and they were talking about doing away with Obamacare? And what we were experiencing at health insurance companies is people calling in saying, okay, I need this done, this, that, and the other. And we were having to tell them, now, right now, you don't pay anything for this procedure. Your out of pocket is zero, other than paying your, office visit copay. You're not paying anything. But after Obama, if Trump gets his way, you're gonna have to pay some of this cost. People were starting to realize, wait, hey, wait a minute. You mean to tell me that the only reason why I'm getting this is it doesn't have anything to do with my employer's health insurance? Is because of the ACA? And we were saying, yes, it's not that your employer set it up this way. They have to follow, federal guidelines. And Obamacare says that they must pay for this, that, and the other for you as their employee. So that's why you saw all those town halls where a lot of folks were falling out and they raised such an uproar because they knew that it would go back to the way it was before Obamacare. Think about this: before Obamacare, you could not keep your adult child up to age 26 on your health care. But after Obamacare, you could. Say you had a child that had graduated from college or was out there on their own and they just had, a job, a little job, but their healthcare insurance wasn't that great or it was really expensive on their job. You could keep them on your healthcare insurance because more than likely as the parent you've been at a company and your healthcare insurance is better than what your child's would be, and you could keep your child on. All of these things came about because of the Affordable Care Act and quote unquote Obamacare. I just sometimes when I'm sitting up watching, or viewing things that people say about healthcare, that I know from working at all these different freaking health insurance companies that I've worked for over the last years, the last 11 years, it just bothers me when you know that it's not true. Like, I'm going to tell you something that is the one thing that I will say about working for health insurance companies. They ain't paying on shit that they think is suspicious. Let me give you an example. When I first started working in health insurance, let me tell you where I had come from and why health insurance was new to me. I had been a corporate travel agent for like 16, 17 years. So I came from the travel world. I wasn't one of those travel agents that booked vacations or anything. I booked travel for business travelers. But I got laid off during 2008, 2009 when, they had that recession. So I couldn't find a job in travel. The first place that called me was Anthem Blue Cross Blue Shield. And I was like, how am I going to transition from being a damn travel agent to working in the healthcare industry? Well, Blue Cross gives excellent, they have excellent training. So I did my training for the weeks that I did, got started in healthcare and all this. I remember getting this call from a doctor's office. And this claim sticks out in my mind even after all these years. There were twins born in the hospital. One twin was born healthy, and the other twin was very, very sick. And the doctor's office kept telling me, they told me that they kept submitting their claim. And every time they submit their claim, Blue Cross wasn't paying it. And every time they got the denial back, it was a different reason for not paying it. Now, let me tell y'all what I noticed. Okay, the first time that the claim was denied, Blue Cross denied it because they said that the baby's name was spelled wrong. Then the second time, I'll say they denied it because the provider didn't, I'll just say, submit it on the right claim form. Then the third time, fourth time, fifth time, every time it was a different stupid reason. Now here I am new to the healthcare game, health insurance game, and I'm like, well, they know that this is the baby, because even though Blue Cross kept denying it for all these different crazy reasons, none of the medical procedures or medical information changed on the claim. It was just the provider needed to fix certain things. So eventually, after this claim had been submitted for like 5 or 6 times and the provider kept getting denied, me being new in healthcare, so I went to my supervisor and I was like, well, I showed her all the different times that it had been denied, and it was for stupid reasons. And I was like, why won't they just pay this claim? This baby is sick, um, near death, and we're not paying the hospital who is fighting to keep this baby alive. And they're saying, well, don't look at it this way. Don't get yourself so caught up in the personal aspect of it. We have to follow the rules. And I mean, like, y'all, the name spelling was like this, the incorrect name spelling. Say the baby's name was Tanisha, Tanisha, and say that the hospital submitted the claim and they left off the A at the end of the baby's name. Blue Cross denied the claim. I mean, I was sitting there like, Tanish, I mean, we have it listed in here as Tanisha. Can I just call the provider and tell them, you need to add an A on the end of the baby's name because the baby's name is Tanisha? You know what they told me? We cannot tell them how to build their claim. We can just tell them something like this: there's a problem with the baby's name. Now I couldn't say, and our calls are monitored. I couldn't say the baby's name is spelled Tanisha, not Tanish. You left off the A. Just rebuild a claim with the A. It was little stupid shit like that. But the reason why that I bring that up is when I first started out in healthcare, it almost felt like that the insurance company was doing everything that they could not to pay the claim. Also, too, back then before Obamacare, that if you had a pre-existing condition, they weren't paying your claim. You also know that before Obamacare, insurance companies had cap limits on how much that they would pay in the life of a one of their members. So let me go back to that baby, those twins again. The baby that was born that was sick had capped out. In other words, Blue Cross said this. I'm just giving a number because I don't remember exactly what the cap amount was. We will only pay within, we will only pay like $200,000 in, say, a year for this individual member in healthcare costs. Well, the baby's birth alone exceeded that. Because the twin was born with so many health problems, the very first claim that we started to receive, the baby capped out on on the amount that the insurance company would pay. So let me tell you what Blue Cross did. So they just say that the claim that the hospital submitted was for $500,000, and Blue Cross, for that baby, I'm just going to say that Blue Cross would only pay up to $250,000 in a year for that baby. So the other $250,000, this is what the parents had to do. They had to go to Medicaid to help with any additional costs that that baby might incur for the rest of the year. Say the baby was born in January and they capped out on their insurance January 1st. After that, Blue Cross wasn't paying nothing. I mean, literally, y'all, what that means is if the baby needed to go for, their immunization, they weren't paying that. If the baby had a cold and or a fever and they needed to go to the ER because the baby was running a high temperature, they wasn't paying that. They weren't paying any of it because the insurance company felt that they had capped out on what they were paying. So prior to the ACA, the parent would have had to get the baby, put the baby on Medicaid because their insurance company, had cap limits. After the ACA, Obama says that doesn't make sense. You know, these members, your members, are still paying, premiums and all of this. Why are you, just say a baby is born January 1st and on that very first day of the year, they reach the limit, but the parent is still paying it out their paycheck for the rest of the year. Blue Cross is still receiving premiums for that baby. So part of the ACA was, we're going to do away with those limits, we're going to do away with that. So these are all the things that, as I sat back as a health insurance, person, working in the health insurance field, and I would listen to my mother, when the ACA came out, and I would start telling her, don't believe what you see on television, because when we're getting calls at the insurance company and we actually break it down to these people, how Obamacare, the ACA. I hate calling it Obamacare. I like calling it ACA. The Republicans attached that name to it to make it seem like it was something negative. I call it the ACA. The reason why, I was getting upset is because I was seeing all the good that it was doing. And the media, or I'm not going to say the media, the Republicans were making it seem like it was something that was so bad. Well, I tell y'all this: try to get rid of the ACA now. Now, I'm not saying that it's not perfect, that it doesn't have any kinks, that it's not things that need to be worked out. There are, but it's better than nothing. We needed some guideline to, first of all, keep the insurance companies in line, you know, because basically, if you have a newborn baby and the baby is deathly ill, and you say, well, I'm only paying 250,000 after that, you on your own, you and that baby, I wish y'all, all the luck, but this is it for us. We're not paying no more. Especially when, insurance companies are raking in billions of dollars from their members, their policy holders. How fair is that? So I guess the whole point of this video, y'all, is when it comes to anything related to your life, do your own research. Don't just blindly believe what folks are putting out on the internet, putting out on social media, or that you heard, because a lot of times you can save yourself a whole bunch of heartache and a whole bunch of misinformation by just doing your own research and asking questions about it. Because a lot of this shit I didn't even know until I start working in this healthcare field. A lot of stuff I learned as I was sitting in those offices working with nurses and a medical director that's a doctor, and having the ability to actually walk up to them and say, hey, what is blah, blah, blah? And why is it that you don't pay this? And having them take their time and explain it to you. Also, to y'all, before I get out of here, and this is something too that that's really bothering me, that's happening with these hospitals, these doctors, these nurses. They are going through hell, y'all. And I want to talk about a friend of mine who is a nurse. I met this girl. Now, first of all, let me tell you, I'm 55. I met her when I was in college. The first night that I was at Kent State University, I met her. I was walking through the dining hall. I was lost. I was away from home. I didn't know anybody. Here I am, a little black student from the hood, at this college with all a sea of white people. And I look over and I see this black girl sitting at a table by herself. And I said, Lord, I'm going to walk up to her and I'm just going to introduce myself and I'm going to make a friend of her today because I need a friend. I need a friend. And I have been friends with her ever since. I was 19 years old when I met her. So a couple weeks ago, she comes on Facebook and she talks about what she's going through treating these COVID-19 patients. And she's sitting in her car in a parking lot outside the hospital crying. So immediately when I see her video and that she's live, I click on it. And what has happened is that she treated a COVID-19 patient and she didn't know as a nurse, when she went in that room, that patient was positive. Her nursing supervisor didn't tell her. Now, what my friend says is this. She said, because of COVID-19, she did have on, proper PPE. But had she known before she was going in to that room that patient did have COVID-19, then she might have added something extra. Now, what had happened is because she was exposed, she had to get a test. And she has an 11-year-old son. So she's sitting in a parking lot waiting for the results of her test. And she's crying because she's worried. She's, talking about if something happens to her, she lives in Atlanta and it's just her and her 11-year-old son. Her daughter lives here in Ohio. She's worried. She's making us promise that if something happens to her, that we'll all help get her son back to Ohio. So being a nurse and having to go back in, I guess her results for where she was working, she got it back pretty quickly and found out that she tested negative. But then what happened? So she continued on working that week. Then what happened is this past Monday, she comes on again and she has pictures of herself all gowned up and masked up. And she's saying that she just got 4 more COVID-19 patients and she's worried. She said that it's not a matter of if I'm going to get the virus. At this point, I've treated so many COVID-19 patients. It's just a matter of when I'm going to get the virus. She says that, of course I have a will, but what this has made me do is take my will out and make sure that, my son is going to go where I want him to go, how I want him to be there, that this money that I have, left for him is going to be spent the way that I want it to be spent. Y'all, it was just sad. It was sad. And I'm sitting up there, looking at my friend just she wants to help. Now, this is what I admire about these healthcare workers. They are so driven to be that person there holding the hand and nursing that sick person. But on the same token, they are like stressed out about carrying it home to their families. Now, the reason why I say that is because I had inboxed my friend and I told her, I said, girl, right now, nurses are in dire need all over the country. You can walk away and, from actually working in a facility and go work for a health insurance company where you're in an office, you're not coming in contact with health, with people that are infected. You're just reviewing claims and authorizing procedures, because that's who I work with when I'm here at the health insurance company. I told y'all I'm a like appeals and grievance coordinator, and basically I review procedures that are denied or need authorization, and then I get it over to a nurse so she can do her medical thing. I just make sure that all the information that the nurses need to review and approve it is there. And I work with the facility to make sure that it is there. So that's what I was telling my friend. Please come out the hospital and go, until they figure this shit out, go work at a health insurance company. You got that baby to take care of. He only 11. He needs you. Let me tell you what she told me. She was like, Rachel, this is my calling. She said, she said, I have to be here. I feel like even though I'm taking my life into my hands, I'm needed. Man, that is something that y'all, I don't have. I don't have. I don't think that I could put routinely on a day-to-day basis 12 hours a day, because this girl is working 12-hour shifts, sometimes even longer. I don't think on a daily basis I could put my life in danger and leave my kids without a mother for a person that I don't even know. And that's what these healthcare workers are doing every day. My friend even told me that she has taken to not wearing her scrubs, on her way to work or leaving work, because they're getting a little backlash, from the public believing that in some way that they are, I guess, passing the virus or giving these patients the virus or lying about the number of people that are infected. Y'all, this is crazy. My friend is like, why would I lie about having to suit up like I'm an astronaut to go into the room to treat a patient? Why would I lie about that? What is she getting from it? I don't know, y'all. This is just a crazy time when it comes to our our health care, what's going on in the country. Just all of it is crazy. To think that a nurse has to wear her street clothes to the grocery store because she has someone follow. Now, this is what happened to my friend. She has someone following her to her car, yelling and screaming at her that they believe that this is all some type of hoax, that these facilities are padding the numbers and just all this kind of crazy mess, y'all. What the hell? What the hell? So on my Facebook page, I ask people to remember that those nurses and doctors, they're people just like us. They have families. My friend told me that the way that she has to come, like when she gets off work, after working with those COVID-19 patients, I think I said this in my last video. She said that the way that she comes in her house is she has an attached garage, and that she strips literally naked in the garage, puts, I guess, her scrubs, her sneakers, all of that into a bag, and she's only wearing white scrubs now so she can bleach them, and she immediately puts her stuff into her washer, which she's had moved into her garage so she doesn't have to carry her clothes into the house. She washes it, and then she says she puts on protective gear and walks to her bathroom and immediately showers for like 30 minutes and then disposes of I guess what she wore to walk to the bathroom in, because she's afraid. She said that she even has taken to not actually touching her son as much as she normally would. Like, giving your kids a hug or when they get out the car or whatever, and excessively cleaning at her house. Now, think about it. The girl already working 12 hours. She can't get a hug. And when she go home, she's cleaning her house excessively because she's so afraid of carrying that virus home to her baby. Y'all, I ain't built like that. I can work in the insurance company, reviewing the claims and the procedures and authorizing procedures, for people who are being treated with that virus, y'all. But I'm not built to be, you know, in a hospital watching people suffer. That's another thing she talked about, is what those patients actually are going through. Now, she did say that a lot of people that get it, they do recover and all that. She said, but for the ones who are sick with it, she said, Rachel, it is like nothing I've ever seen. Now, remember, we are 55 years old. So she's been a nurse for like 30 years. And she said, I've never seen the suffering. She said every patient does not have the same symptoms, that they're not coughing and sneezing like what we've been told is like the first, I guess, sign that you have it. She talks about their eyes being red, spots on their feet and hands, um, all kind of weird little things happening to them. And she said each patient is different. And when I talk to her, I almost feel like, that plague that they speak of in the Bible, y'all. And I'm not like a really religious person. Now, let me backtrack and say this. I don't go to church, but I believe in God. I believe Jesus died on the cross for us. I'm spiritual. But that plague that is spoken of in the Bible, I actually believe that this is it. You know, so much stuff is going on now that, our grandparents and parents used to talk about, we living in our last days. Y'all, I know we don't know the time or date, only God knows that. But it's so much happening that it makes you almost feel like if we're not actually living in the last days, this time that we're living in now is leading up to it. The period before the last day. If you just look at stuff on the news, you know, everything is, this is the worst tornadoes we ever seen. These are the worst hurricanes we've ever seen. This is weird. We have millions of birds landing in a parking lot. We have, uh, animals dropping dead and all this kind of crazy mess. It makes you wonder about, you know, what God thinks of us. And like I said, y'all, I'm not, a Bible thumper. I'm not one of those people. But I am a person that I sit back and I think about stuff, and it makes you wonder, how you like, Lord, are you unhappy with us? Is this why all this stuff is going on? I even read an article yesterday about this these parents who had abused their child so badly that the police officer that went in, I guess, when they found out this abuse was going on, that first police officer that went in, when he was trying to explain what he had witnessed, he was crying so badly that I was sitting there only imagining what this big burly white police officer saw in that house that had him crying like that. He said that he had never seen anything like what he saw in that house, and that he wanted to stay in contact with that child for the rest of that child's life to make sure that that child was okay. This is the kind of stuff that we're living through. Kids killing parents, parents killing kids. Crazy mess, y'all. Crazy mess. So, with this plague that we're now all facing, and we're forced to be in the house, I'm wondering, is God saying, you know what, Earth, it's time for me to put y'all on pause, to make y'all reflect on, this world that I gave you, all this beauty that's in this world that I gave you. and y'all just taking it for granted. You know, you are down there causing all kind of mayhem and just craziness going on. And I, as the father, need to remind you here on earth what I have given you. I truly believe that, y'all. And again, I'm not real, you know, I can't even tell you the last time I've been in the church. But when you are a thinking, breathing adult and you look out on the world now, you can't help but to wonder what's happening, you know? Um Fortunately, I have a grandmother that is still alive, that is almost 100 years old. So when you have that body of someone who's been on this earth that long, you start asking them, like, we call my grandmother Mama. We say, like, Mama, have you ever seen anything like this in your lifetime? Do you ever remember, like, in your 90 something years, it being this bad? You know, they have a total different view of the world than we do because they've seen so much. And when I hear my grandmother say, I've never seen things this bad. She, she talks about living through the Depression, the Civil Rights Movement, all the turmoil, the wars that the United States have been involved in. But she also talks about, things not being as bad. She said even when she used to have to, you know, walk miles to a grocery store or like a butcher's, because back then they didn't have all these big grocery stores. They would go to the meat market, the baker and all this, and haggle with the butcher to get meat at a low price for her family. She said she always still felt that things were going to get better. But she said, looking at the way everything is so bad now, that she's worried, you know. She's worried about how long this period of instability in the country is going to last, and what it's going to take for us to get back to some sense of normalcy. Now, that's the part that scares me. When she says, what what has happened in the last few years, it only took a few years for it to happen, but it takes so many more years to correct all of it. And in the meantime, what does that mean for us? Another thing, y'all, is voting. And then I'm gonna get out of here because I got things to do. But today I was just in a melancholy mood. But there are a lot of people that I know, and I got some family members very close to me who think like this. They'll say stuff like, "Well, I ain't voting. My vote don't count. It don't mean nothing," you know, or I literally don't vote. You know, that's what some of my family members will say. And sometimes when I walk away from them, I'm like, take a chance, you know? When I go vote, y'all, I'm in and out in 5 minutes. Let me just tell you, I vote at the school that's down the street from my house. I literally can walk to the school. So when I'm on my way to work or when I was going out to work and in previous years, previous elections, I had to pass this school before, as I'm going to work. So I don't like to vote at the end of the day. I like to get up and do it in the morning. So one day I said, you know what? I'm going to go to vote before I go to work because I don't want a chance. I might have to work overtime and I might not get to vote. So let me do it before I go to work. Y'all, I pulled up in the parking lot, and from the time I jumped out my car to the time that I actually was in the booth voting, I would say it took all of 10 minutes. Literally, I walked in, you show them your ID. They give you a little sticker to say I voted today or whatever. They point out the machine, you go, and then I always write down the issues because I'm not gonna remember all that stuff. Who I should be voting for judge and representative. I get one of those things and I write it all down so that way when I'm in the booth, I don't get twisted and vote for the wrong motherfucker, y'all. That's funny. But so even with my notes, and me standing up there with a note, like, make sure you vote for this judge, don't vote for that one. Make sure you vote for this issue. Yes on this one, no on that one. 10 minutes. 10 minutes. So what I'm asking you to do, especially this time, y'all, when y'all know who we got in the White House, okay, we cannot stand another 4 years. We really cannot. Not only do I think this man has dementia, I think, as my mother say, he's literally, as my mother says, he's literally insane, y'all. Literally, something is wrong with that motherfucker, y'all. Y'all know I ain't just saying it. Something is wrong with him. So in November, even if your state is voting from home, vote, vote. And do something that my son does, because my son is really into voting, and he registers voters and all that stuff. If my son thinks that I don't know which issue to vote on or whatever, he will call the DNC and have them send me all, those flyers that you get that tells you about the issues, and if you want to vote a straight Democratic ticket, this is the, he'll have all that shit mailed to my house, y'all, or he'll ride by and put it in my mailbox. And y'all, this boy will call me first thing in the morning on voting day. Ma, you up? You voting? Now let me tell you why he's like that, and then I truly gotta get out of here. When Obama ran the first time, I was not an Obama fan. Let me tell you why. I just didn't know who he was. I had never heard of him. So back then, prior to him starting to run, I was a Hillary fan. And the reason why is because I knew Bill. I figured them two was together. Look, I wasn't voting for the Republicans, so I was going to vote for Hillary. But what happened is one day my son came in the room, and at the time, I think he was 2021 or something. And he said, Ma, I want you to listen to this new guy that's out here. It's a black man running for president, and his name is Barack Obama. And, he is something else, Mom. And my son had to go to work. And before he was going to work, he was listening to this speech that Obama was giving. And I believe the speech that he was giving was in Iowa, when it was right after Obama won Iowa. So y'all, my son took my remote, turned the television to the speech, and he told me, Ma, I want you to watch it, because when I come home, I want you to finish, the parts that I missed. I want you to tell me what he said. So I said, okay, boy, I'll watch it. Look, I'll watch it, to appease him. Y'all, I started off watching from laying in my bed, propped up on pillows. By the time the end of the speech ended, I was at the end of my bed, sitting on the edge, just listening intently to what he said. I watched my son go from a young man, I should say, because he wasn't a child, he was 20 or 21, who really wasn't into politics, get so involved. First of all, he was out doing canvassing, registering voters, um, you know, all this while he trying to go to school at work. He would get up, go down, work at the DNC, calling people. I mean, this boy would be out to 12, 11, 1, 2 o'clock in the morning with the DNC. I would call him, be like, where are you at? And he like, well, Mom, they got an event over here, and I wanted to go there and do this, and I want to help out doing that. So all of this led up to, Obama winning and all of that. My son registered voters, did all of this. Then my son calls me one day, excited, y'all, like screaming, Mom, Mom. I'm like, what is it? Now, by this time, he no longer lives at home. He's out on his own in his own apartment. And he said, Mom, guess what? I got invited to the inauguration. And I said, what? And I said, what are you playing? Quit playing. He said, no, no, no. I get 2 tickets to the inauguration. And I said, are you serious? He said, yeah, well, the last day after, Obama won, I was down, at the DNC, wrapping up loose ends. And, you know, he said I left and, they thanked me for really helping them and putting my all into it. So here's what happened. I didn't really believe him, y'all. I thought, he was going to probably jump in the car with some of his friends and just go to Washington to view Obama being inaugurated. But let me tell you what happened. A day before my son was supposed to take off for Washington, I get a call at my house from some office in Washington. And my son's name is Aaron. So they said, yes, this is blah, 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 calling from blah, blah, blah. And we're just calling to confirm that Aaron, and they gave his last name, where he's to pick up his tickets when he arrives in Washington. So I'm sitting there like, oh my God, he really did, get tickets to the inauguration. Literally, he had a seat, a confirmed seat. So inauguration day comes. I didn't go. He wanted me to go with him, but my son has this aunt that he is very, very close to. And in the past, she's taken him on trips all over. Foregoing taking her man, she takes my son. So, because she just fell in love with him when he was born. So I told him, I'm happy that you got the ticket, but I can I cannot go so you can take your auntie. So they drive there. The next day, when my son got there, he called me and he said, Mom, I'm standing in front of the White House. And so I said, oh, we call him Scott. I was like, oh, Scott, that is so nice. I said, I know you're so proud of all your work that you did. Look where it got you. You got a seat at the White House, a reserved seat at the inauguration, I meant to say. So he went to say something and he started crying. Now, at the time, I think he was, if my daughter was 14, I don't remember. He was early 20s. I don't mean just crying, y'all. He was boo-hooing. So I was like, oh, baby. I said, what's wrong? This is a happy time. And he said, Mom, that's exactly what it is. He said, I cannot believe that I am standing here. He said, and do you know that I see moving trucks? And I said, really? And he said, yeah, they're actually moving in. And he was so proud that he was able to go. And President Obama, excuse me, y'all, so inspired my son that I saw a change in him. You know, literally, let me tell you what happened that I didn't know when he was there. I didn't know until he got back. So I get off the phone with him. It's the morning of the inauguration. I go over my mother's. We watch the inauguration together. My son is supposed to come home the next day. So he comes home. He calls and tells me that they're driving back now and that he'll see me when he gets back. So I didn't think anything more about it. He has his own apartment. So I'm like, well, he's going to call me. He was telling me, Mom, I got you all kind of souvenirs. I got the newspaper from, Washington that announces Barack Obama's inauguration. I got you all kind of stuff. So I'm just waiting to get my souvenirs. So roughly around the time he should be back in Ohio, there's a knock on my door. But while there's a knock on the door, my phone rings and I can see that it's my son. And he said, Mom, that's me knocking on the door. He said, but before you run downstairs to open the door, I want to tell you something. And I said, what? He said, I ran into a little trouble when I was in Washington, and I'm kind of like in bad shape. And, when you open the door, I don't want you to be shocked when you see me. So what happened is my son, being so happy to be in Washington the night before Obama was going to be inaugurated, he met some young guys that were around his age, and they invited him to away from his hotel or wherever he was staying to go, have a couple drinks with them. Now, he's so trusting and so sweet. I had told him before he left, I said, don't venture away from the group. But he a grown man, y'all. He 21, 22, 23, somewhere in there. So I couldn't really tell him what to do. So he figured he a man and he can handle himself. He went away. He stepped away with those young men. Well, they beat the shit out of him. They robbed him and beat the living shit out of him. So what he was trying to warn me when I opened the door is that he was he was fucked up, y'all. Black eye, bruises all over his body. He could barely breathe, like inhale deeply. I believe that he probably had a bruised rib or something because he couldn't even breathe deeply. There was a big gash in the back of his head because what they did is they hit him. He was walking ahead of them and they hit him in the back of the head. Um, and he fell. He said that he tried to fight back, but it was like four of them. So what he did is he just balled up in a knot. They took his shoes. They took, I think he had his phone. I think, yeah, they didn't get his phone. They got his coat, they got his watch, and they got some other stuff. So when he had called me, you know, I guess after calling me saying that he arrived and he was standing in Washington, when he had called me that night, he had been whooped up. I just didn't know he had been whooped up. Y'all, when I tell you, I got him down my basement. And literally that's where he stayed for the next week. I had a shower and bathroom in my basement, so he didn't have to come up to shower and bathroom to shower and go to the bathroom because it was, down in the basement. And literally he couldn't come up the stairs. Physically, he didn't have the strength. So what I was having to do, I worked from home during that time. So I had to bring my stuff up out the basement so he can be comfortable. I literally had to bring food down there to him. I had to go to his apartment, get him some clothes because he literally could not move. Actually, I think he needed to go to the hospital, but you know how it is when it first of all it's a man and secondly a young man. I couldn't make him do what he didn't want to do. But I had to nurse on him for a little over a week before he literally could come up out the basement. When I tell y'all they fucked my son up, y'all, he even had bruises on the back of his hand, like skin, deep marks of skin tore off the back of his hand. So I was asking him, like, how did they get your hand, Scott? And he was like, well, Mom, when I was on the ground, when they were kicking me, I was moving, I was balled up. And he said, like, they were picking me up and throwing me and stuff. So as a mother, you're sitting there like, oh my God. Now, during all this, him telling me there's blood everywhere, I could tell that he probably was bloody everywhere. He pulling out of his book bag all these souvenirs, like, look what I got, and I got you this, and I got you this. So even though he's fucked up, he's so happy that he saw that he went to that inauguration that he is like oblivious to he sitting here looking like a freaking alien because they done stumped the shit out of him, beat him all in the back of his head and all this. And literally when he was cutting his hair, because he cuts his own hair and trims his own beard, he had to come to me, like have me come down the basement and um cut around, help him cut around the gash in the back of his head, making sure that no hair got into the wound. And I was having to pour peroxide on that, y'all. Oh God, it was so nasty. And because you know how peroxide will bubble up. Oh Jesus. And the bubble up stuff was mixed with like blood. So I'm pouring peroxide on the back of his head, like, gagging. Y'all, it was a mess. So I just brought all that up to say this. This is what my child went through to 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 make sure that he was able to register voters. I was so proud of him, y'all. Like I said, I saw a change in him, and now he is obsessed with politics and and registering voters, and like he will go downtown and picket. Y'all, another thing he did that I thought was funny. You know how like people are protesting for different rights? My nephew, one of my now this is funny. My nephew called me one time. He was with my son and he said, Auntie, He said, I said, where are you at? This nephew has since passed. He said, I'm with your son. He said, I said, well, what y'all doing? He said, we down here protesting. I said, oh. He said, now they're paying us $17.50 an hour. He was like, because we actually work for the DNC. He said, but guess what? We down here protesting. He said, I'm standing here watching your son protesting. I said, now knowing my nephew and my son, I said, is it something to do with marijuana? Because both of them don't see no problem with, folks smoking marijuana. My nephew was like, "No, nah, auntie." He said, "We're actually down here, protesting for gay rights, LGBTQ." I said, "Really?" He said, "It's not my idea. It's your son's idea." He said he is over there marching and all into it like he gay. He said, "I asked him, man, what are we doing down here?" And then he said, my son was like, gay people got rights too. And if I'm marching for everybody else, if I'm going to be protesting I'm going to protest for them too. So I couldn't do nothing but laugh, y'all. My nephew he wasn't feeling it. He only went because my son got him a job working in the DNC. And while my nephew at the time, I think was 18 and 19, and had never made $17 or $18 an hour. He was like, oh, well, $17, I'll go. But he didn't know what all that entailed. So I said, Chris, he said, I'm not going to be, auntie, I'm not walking carrying no sign. He said, I don't have nothing against gay people, but they got the news media down here. He was like, I'm not trying to be on television, on the news this evening, carrying a sign for LGBT. I laughed so hard. I just said, well, this boy has gotten the bug, the politics bug. And I just wish everybody was like that, because I also have a family member that I don't know if they've ever voted in their life, and they're my age. I don't know if they've ever voted. And I asked him, I said, well, do you think something's going to happen to you if you actually go into the booth and vote? Like, what you think is going to happen? I just don't believe in it. I think that's stupid, y'all. And here's why I think it's stupid. Think of all the people that came before us, that they literally died. They were willing to give their lives so that we can vote. They didn't know if they were going to necessarily be able to walk safely into a voting booth and vote without being lynched or, dogs turned on them and all that. But they did it so we can have the right to vote. Remember that probably in my lifetime, if I'm 55 years old, remember there was a time that we weren't able to vote, and it's been in my lifetime. Think about, let's just let that settle in for a moment. Here I am, a 55-year-old woman. I was born in 1965. Think about the fact that in my lifetime, Martin Luther King gave the speech in Washington and all of that. And remember, they were fighting when I was born for us to have the right to vote. And we won't even go. We get an attitude if somebody, say something to us about us not voting. Do you know that our parents' generation sacrificed so much for us and fought so hard for us to have all these rights we have now, that they fought for it, but we are enjoying, and we won't even vote? Don't y'all just think that's just, I don't know, y'all. So I think the reason why my son and my daughter both vote and they are really into it is because every year I used to make them watch this thing. It was on Martin Luther King's birthday. And no matter where I work at, whether they have it off or not, I'm taking it off, in honor of all the people that um fought for us to have right. So on Martin Luther King's birthday, when my kids were still at home, I used to make them As a family, we would watch him give the speech every single year that they were home. And all day I would make them watch movies about, civil rights leaders and stuff that we had to go through, roots and all that. I made them watch all that shit. I know they wanted to whoop my ass, but they couldn't because I was the mama. I made them watch all that shit. They would be sitting there looking at me like, oh, if we could kill this heifer, we want to go outside and play. But I think in doing that, that's why they are like they are now, where both of them voting means a lot to them. So, how as a parent you wonder if some of the stuff that you put in your kids really really took. Well, I'm gonna tell y'all, this voting thing or anything to do with politics, my kids, well, more specifically, my son, the very one who was protesting the most when he was little, is in him. So something he tells me every once in a while, now he's 33, he'll say stuff like this, like something he'll do will surprise me, like, how you're thinking, who is this man that I now have? Because the teenage Scott hated my guts out, and I didn't know you even were listening to when I was trying to teach you this. He would tell me stuff like this. Oh, mom, I was listening. He was like, but I just couldn't let you know that I was. He was like, he said, you used to like to argue all day. He said, it seemed like it was entertaining to you. So I just let you argue. He was like, it was your house. We couldn't get a word in edgewise. He said, but we got it. We got it. And so I do realize now that a lot of stuff that I did not even think, I just thought they were looking at me like, I wish this woman go somewhere and sit down before I bop her upside her head. They really were listening. So with that, y'all, I am going to get out of here. Just keep in mind, if you know, make sure, check your registration, make sure you register, y'all. I'm going to check mine again, even though I just voted in the little primary here in Ohio. I'm going to keep checking weekly, monthly, because I don't trust Trump enough. I think Trump know he about to be a one-term president, and he going to be doing all kind of crooked shit to stay in. And I believe that, he worried about us voting, via mail, because he knows that if a person does not have to actually leave their house and go anywhere but to the mailbox to vote, they don't have to take time off work or go before work or after work, that something's going to be mailed to their house and all they got to do is fill it out and then send it back. More people are going to be voting, y'all. I truly believe. And also, I do believe that it is going to be, especially after this virus, that it's going to be a blue hurricane, a blue tsunami, because I believe now we have had a chance. Prior to him getting into office, we hoped. Now us as black folk, we knew this shit wasn't gonna turn out, but we hoped and prayed for, things to go okay. But now we'll have had we will have had 4 years of his shit, and we know what the next 4 years would entail. So now, for those people who didn't vote the last time, I truly believe they're gonna vote this time. I have no doubt that the thug that shoot basketball on the corner at the playground, he gonna be voting. I believe the ghetto girl with the purple, red, green, and yellow hair, she gonna be voting. She gonna throw her babies on her back, and I don't believe that it's going to be a person that's going to be sitting now and saying, oh, I can just, sit this one out, because they know that we would have another 4 years of him. So y'all, what I'm saying is check your registration. If you got to check it weekly, at least monthly, make sure it ain't no shady business with it. So that way, when November rolls around, we can get rid of him. Now, y'all, another thing. Now, I'm silly, so I cannot wait until November to see if Joe Biden wins, and I'm going to speak it into existence. Let's say when Biden wins, how Trump takes it. Because y'all know he ain't nothing but a big baby, a spoiled little rich boy. He act like a little, whoever raised him did a horrible job raising him, y'all. Horrible. But I want to sit back. I probably have three televisions in the room just to watch, because I want to see, like, when the inauguration comes. And you know how when the new president comes in, the old president sees them off, and the old president flies away in the helicopter. Remember how when Michelle and Barack were leaving, they were standing on those stairs and they were saying goodbye to America, and basically we was welcoming in the Antichrist and his wife. Remember how they flew away? Well, I cannot wait to see the transition of power when it comes to Trump and his hooker wife, y'all. I cannot wait to see, because y'all know we got a hooker in the White House, ho hopping hooker, and then we got a food too. So y'all, this is just, it's gonna be interesting the next few months. It's gonna be interesting. Y'all, I'm about to get out of here. I have got to get down my basement and exercise, because being at home, child, I ain't cooked this much in my life since my kids been out the house. But and we not going to fast food places. I am thinking up meals, and it's ridiculous. When I leave this house, when all of this, you know, shelter in place is over, I'm gonna be looking like one of the weather girls, y'all. I was already thick built, but me cooking, um, it's ridiculous. It's like every time I think I go downstairs, I'm like, let me look in the refrigerator, and I'm gonna eat this. Last night, I found myself up at almost 3 o'clock in the morning watching a movie and eating peanut butter and wheat crackers in the middle of the second, after I finished off the first roll of crackers, and I went to open the second roll of my little wheat crackers. I said, what the hell are you doing, girl? It is 3 o'clock. Take your ass to bed. You are up just finding shit to eat. Even though it was just peanut butter and crackers, at 3 o'clock I should have been asleep. I'm at that age where I don't need but 4 or 5 hours sleep. So I'm up all at the crack, in the middle of the night, eating snacks and cooking shit. This is ridiculous, y'all. I got to go down the basement and walk on my treadmill and try to fight off this bubble gut that I got. And child, is ridiculous. But y'all take care, be safe out there, and as always, thank you so much for stopping by. I don't even know why y'all be sitting here listening to me rambling on, but I appreciate it. Again, stay safe. See y'all next time. Bye bye.